Hello, big team. So this is Vincent, and it's just a continuation of the part of care plan for a patient with a neurological problem, and in this case, we are using a sample of Joe who came to A&E with head injury and is confused and is having severe currently, so might have issues with swallowing. Now, in the event that you did assessment of this patient and they were not in pain, and maybe you had planned yourself with your pain points to go and do and place them for your care plan, then you can consider risk of aspiration. Now, if it is risk of aspiration, remember, you don't need to evidence what you need to state. So, for instance, your care problem would be Joe is at risk of aspiration, related to severe following a head injury. Then under aim of care, you state Joe will have reduced risk of aspiration following nursing intervention. Then under reevaluation date, you will say to be reevaluated today, every hourly or every 4 hours, depending on your needs score. This might vary, and remember, you don't also want it to be that long, so you can stay to be reevaluated today, every hour, or more frequently if the condition changes. Then under the care provided by nurses, you can do explain and discuss Joe's care plan and gain consent. Then the part of monitoring, that statement, as we said earlier on, how to be just that specific and similar to both the care problems. So you'll state that monitor and record Joe's vital signs, including neurological assessment, every 30 minutes until the GCS is 15/15, or reviewed by the medical team and escalate to nurse in charge if necessary. Under A, will be administering all prescribed all medications as prescribed and check their effectiveness. Then go for the 3 specific cares that need to be provided. So under the specific, for risk of aspiration, you would consider things like teaching Joe and the relatives on use of soft diet, just to reduce that risk of aspiration. Also, there's aspect of providing soft diet to reduce the risk of aspiration. There's the bit of monitoring and supervising all the meals given to Joe to ensure this risk of aspiration is reduced. And there's also a bit of referring Joe to the occupational therapist to help with things like gaining their feeding back by themselves. Then the next point will be teaching Joe on proper use of call bell in case of need of help, and also recording all the cares as planned. So with that one, you will have a backup plan in case you don't have any other, maybe you didn't capture anything for your care plan during your assessment. But remember, you must ensure that during the paperwork you are given for your assessment has these issues, like maybe there's compromised swallowing, maybe due to CVA, or and things of that kind, and that will work for you perfectly. Bye and take care. Remember to subscribe and follow for any new upcoming videos for the new Osce. Thank you and take care.